This presentation is on reproductive medication by Anjali, Autumn, Emerson, Jamie, and Kayun. Hi, my name is Kayun and I will be talking about women's reproductive contraceptives. There are many forms and types of contraceptives that are available for women today. Some of those include the birth control implant, birth control patch, birth control pills, birth control shot, vaginal ring, the diaphragm, an IUD, and some forms of emergency contraceptives, also known as the morning after pill. There are two types of contraceptives, the barrier and the hormonal. Normally, a woman becomes pregnant when an egg is released from her ovary and it's fertilized by a man's sperm. The fertilized egg attaches the inside of a woman's womb where it receives nourishment and develops into a baby. While hormonal contraceptives all contain a small amount of man-made estrogen and progestin hormones. These hormones work to inhibit the body's natural cyclical hormones to prevent pregnancy. Pregnancy is prevented by a combination of factors. The hormonal contraceptive usually stops the body from ovulating. They also change the cervical mucus to make it difficult for sperm to find an egg. Hormonal contraceptives can also prevent pregnancy by making the lining of the womb inhospitable for implantation. The other method is the barrier method. It is designed to prevent sperm from entering the uterus, and barrier methods are removable and may be used as an option for women who cannot use hormonal methods of contraception. Side effects of birth control pills include nausea, weight gain, sore or swollen breasts, small amount of blood or spotting between periods, lighter periods, and mood changes. There are also side effects that are a little bit more serious and can easily be remembered by the word aches. They include abdominal pain, chest pain, headaches, eye problems, and swelling or aching in the legs and thighs. It is an important nursing consideration to notify patients that any type of birth control is not an effective STD prevention mechanism. It's always important to wrap it up, as evidenced by these hilarious pictures. To teach patients that using any barrier form or hormonal types of contraception should be used correctly to prevent any unwanted pregnancies.
Gestational diabetes is high blood sugar that starts or is first diagnosed during pregnancy. During pregnancy, the placenta supports the baby as it grows using the hormones from the placenta. These hormones also block the action of the mother's insulin, making her insulin resistant and thus causing gestational diabetes. Depending on the severity of gestational diabetes, they can be treated with Lantus or metformin, or in some cases can be treated with diet and exercise. If untreated, the fetus will be born as a macrosomic and can have complications during labor and later in life. Most cases of gestational diabetes ceases after pregnancy. Most cases of type 1 diabetes are caused by an autoimmune disease in which a person's pancreas stops producing insulin. This occurs when the body's immune system attacks and destroys the insulin-producing cells in the pancreas called beta cells. The most common type of diabetes is type 2. This occurs when the pancreas produces enough insulin but the target cells do not respond to it, or if the pancreas does not make enough insulin. Anti-diabetic drugs are subdivided into two groups. You have your injectable insulins, which are rapid-acting, short-acting, intermediate-acting, long-acting, and combination. You also have your oral medications, which are your alpha-glucosidase inhibitors, binguanides, meglitinides, and thiazolidinedione. One injectable insulin treatment is Lantus or Glargine. It is a long-acting insulin with an onset of 1 hour and duration of 24 hours. Its action is to facilitate passage of glucose, potassium, and magnesium across cellular membranes of skeletal and cardiac muscle, as well as adipose tissue. It controls storage of metabolism and carbohydrates, proteins, and fats, promotes conversion of glucose and glycogen in the liver. The side effects are hypoglycemia, weight gain, ketoacidosis, somalia effect, which is rebound hypertension, lipodystrophy, and lipohypertrophy. Nursing considerations are to rotate sites of injection, check serum glucose levels, assess hyper or hypoglycemia, tremors, tachycardia, dizziness, and polyuria, polyphagia, polydipsia, and diaphoresis. An oral antidiabetic is metformin or glucophage. The subgroup is a biguanide and comes in immediate or extended release. The actions are that it inhibits glucose production in the liver, reduces glucose absorption in the intestines, and sensitizes insulin receptors at site in fat and skeletal muscle. Side effects are decreased appetite, decreased absorption of folic acid and B12, GI disturbance, metallic taste, electrolyte disturbance, and lactic acidosis can but rarely occurs. Nursing considerations are to assess baseline glucose levels, renal function tests, hypoglycemia, and teach the patient to avoid alcohol and maintain dietary restrictions. And remember, a spoonful of insulin makes the sugars go down.
Hi, I will be talking about beginning prostatic hyperplasia, BPH. It is the most common urological problem in male adults. About 50% of all men in their lifetime will develop BPH. Almost half of them will have a lower urinary tract symptom. Research is not clear about whether having BPH leads to increased risk of developing prostate. The picture next shows the enlarged prostate compressing urethra, eventually leading to partial or complete obstruction. Now we understand why most of symptoms are related to urine, volume, pain, or frequency. Diagnostic is history and physical examination. Digital rectal examination starts at 45 years age, especially for African Americans, where the incidence of the disease is higher. Urinalysis with culture prostate specific antigen PSH starts at 50 years of age, serum creatinine, and transrectal ultrasound. Clinical manifestation, they're pretty much all related to urine. So nocturia often is the first symptom related to the disease. Urinary frequency, urgency, dysuria, bladder pain, and incontinence. Obstructive symptoms caused by prostate enlargement include difficulty in initiation, voiding, intermittency, that is stopping and starting while voiding. Drug therapy, minimally invasive therapy, and invasive therapy are the three main ways that we can deal with the disease. Where drug therapy, I choose finasteride, Propecia, and Proscar are all androgen hormone inhibitors. Action, they inhibit 5-alpha reductase, and an enzyme that converts testosterone into dihydrotestosterone in the prostate gland, resulting in decrease of serum HT and reducing size of the prostate gland. Indication, Proscar reduced risk of acute urinary retention, improvement noted in urinary hesitancy, feeling of incontinence, bladder or emptying, interruption of urinary stream, difficult initiation flow, dysuria, impaired volume force of urinary stream. Propecia is also used for treatment of hair loss. An off-label treatment of female hirsutism is an excessive growth of facial or body hair in unwanted areas. Side effects, very rare: sexual dysfunction, impotency, and decreased libido. Intervention monitors eyes and nose and any sign of toxicity. Patient teaching, patients should be aware of potential side effects like impotence. Need to take medication longer than 6 months. It is unknown if medication decreases need for surgery. Pregnant or might become pregnant should not handle the medication. Another disease is prostatitis. It is a group of inflammatory or non-inflammatory conditions affecting the prostate. One of the most common urological disorders estimates that 12% of all men experience a prostatitis in their lifetime. Diagnostic is urinalysis and urinary culture. Very often, white blood cell count and bacteria are present.
Bactrim is used as an antibiotic for an off-label use of prostatitis, and it's also used for MRSA infections. The action is a bactericidal, which is acceptable to microorganisms. Some side effects include anorexia, nausea, vomiting between 7 to 10 days after therapy begins. There may be occasional diarrhea, abdominal pain, irritation at the IV infusion site as well. Interventions are to monitor the vital signs in the eye and nose, and the patient teaching PO administer on an empty stomach with 8 ounces of water.
Hi, I'm Angela, and today I'll be talking to you guys about genitourinary medications. Genitourinary system refers to the urinary and genital organs such as the kidneys, ureters, bladder, and the urethra. Common problems and diseases that involve the genitourinary system are glomerulonephritis, UTIs, hydrocele, hemolytic uremic syndrome, neurogenic bladder, and a lot more. Some of the medication types that are used to treat genitourinary diseases and problems are impotence agents, psycholytic agents, urinary antispasmodics, urinary pH modifiers, and uterotonic agents.
The 2 drugs for genitourinary medications that will be focused are pyridium and ditropan. For pyridium, its action exerts topical analgesic effect on the urinary tract mucosa. This is used for symptomatic relief of pain, burning urgency, frequency resulting from low urinary tract mucosa irritation. And side effects include occasional headache, GI disturbance, pruritus, skin pigmentation, and orange-red urine. Some nursing interventions to consider are to assess patient for urinary status. You want to monitor their liver function and tests and assess for hepatotoxicity. The patient family teaching is to advise the patient to report any symptoms of hepatotoxicity, caution the patient not to exceed the recommended dosage, and to take with meals. For the ditropan, it is an anticholinergic. It relaxes the smooth muscles in the urinary tract by inhibiting acetylcholine at the postganglionic sites. The interactions include medications with anticholinergic actions, such as antihistamines, which may increase your anticholinergic effects. Side effects are frequent constipation, dry mouth, drowsiness, decreased perspiration, and occasionally decreased salivation, impotence, urinary hesitancy or retention, suppressed lactation, blurred vision, and nausea and vomiting. Some adverse effects are seizure, QT prolongation, hyperthermia, anaphylaxis, and anorexia. For nursing considerations, you want to assess for allergic reactions, assess urinary patterns, assess ECG and QT prolongation, and assess for chest pain. Make sure to advise the patient to avoid hazardous activities until response to the medication is known, as dizziness may occur.
Hi, this is Jamie, and today I will be talking about anti-neoplastic drugs and more specifically their effect on the reproductive system. Anti-neoplastic drugs, which are chemotherapeutic agents, work by differing mechanisms. The types of anti-neoplastic drugs are alkylating agents, antimetabolites, anti-tumor antibiotics, topoisomerase inhibitors, mitotic inhibitors, targeted therapy, and other chemotherapy agents. The one common characteristic is that they kill cancer cells, but can also damage some normal cells in the process. Some common temporary side effects of chemotherapy include nausea and vomiting, loss of appetite, hair loss, hand and foot rashes, and mouth sores. Chemotherapy can damage the blood-producing cells of the bone marrow, so patients may have low blood cell counts. Paclitaxel is often given in combination with alkylating agents in the treatment of cancer. It is a type of chemotherapy drug known as a taxane. It is thought to work by interfering with microtubules, which are part of the internal scaffolding needed by cells when they are dividing into 2 cells. Over time, this leads to cell death. Because cancer cells divide faster than normal cells, they are more likely than normal cells to be affected by this drug. Standard paclitaxel has to be dissolved into another medicine in order for it to be given into the blood, but this other medicine increases the risk of allergic reactions. Nursing considerations and patient teaching. If allergic to anything, have any medical conditions, or have ever had kidney stones, or have ever taken any type of radiation or chemotherapy, Be sure to tell your doctor before taking this medication. Inform your patient that if breastfeeding, the drug will pass into the breast milk and harm the baby. Teach your patient that if trying to get pregnant or if there is any chance of pregnancy, this drug may cause birth defects if either the male or the female is taking it at the time of conception or during pregnancy. They should be sure to check with their doctor about what kinds of birth control can be used with this medicine. Inform your patient that some drugs may cause sterility and advise them to talk with their doctor about the possible risks of this drug and the options that may preserve their ability to have children in the future, such as sperm banking or egg freezing. Also, inform your physician about any other prescriptions or over-the-counter medications that you are taking.
Thank you for watching our video.